There was an impulse to formalize. I hear what you're saying, Bob. It wasn't, we were never all that formalized, but we did have this impulse to start the center. So, what do you think that impulse was about? How would you describe, why did we want a center? What were we
I
going to
don't
do with
I
it?
don't think there was an impulse. I think there was an institutional overlay. Uh,
Mm.
and I think that was really coming from above. I think there was, I went back and looked at one of the letters or the minutes that Joe was able to find, and it was like from I think the fall of 1972, and I think Bob was there, and I think Joe was there, and I'm looking at who was there. I mean, I was there. I mean, Josh Billings was there, David Carzon was there, uh, Amos Christie was there, Jim Blumstein was there. I mean, these were luminaries in the university. I mean, here I'm a second year law student, don't know diddly squat about anything, and I'm sitting there because I think there had been a decision by the medical executive committee at the medical school to support the center. So I mean, so this was sort of I think it was imposed upon from on high, uh, and then we were sort of struggling with how to meld this student health coalition, as you describe it, inchoate method of sort of getting things done in an organizational structure that demanded, accountability and structure and relationship to the medical center's mission to train medical students. It just sort of struck me as it didn't strike me as an issue that Bill would be concerned about, that we had to coordinate the funding and all that kind of stuff. It just sort of struck me that that's something that was coming from Dr. Billings, Dr. Christie, from that end of the universe, and sort of seeing that we needed to put some structure around this to make it more effective. And I think Joe articulated, what was probably going on behind the scenes, as far as the university trying to figure out how it was going to deal with this entity called the center that was doing stuff that was cutting edge at the time, and how is the medical center going to take advantage of it and make use of it in some way.